Today, we have with us Maureen Morgan, a Medicare counselor with Chester County PA MEDI organization, to educate and inform us about signing up for Medicare, and will give us unbiased information on what plans are available so that we can make an educated decision. Maureen, welcome to the show. I really appreciate you joining us today.
Thanks, Bipin. I'm glad you invited me back.
As you know, Maureen, Medicare is primarily considered to be a healthcare provider that's offering options to seniors over 65. However, there is another different categories of people that also are eligible. So let us inform and educate our audience about who is eligible for Medicare. But before that, give us a brief introduction on you and the organization that is doing this fantastic job in Medicare education.
Okay, well, as you said, my name is Maureen Morgan, and I am a volunteer with the Chester County Department of Aging, and it's in the PA MEDI program, which means Pennsylvania Medicare. I have to tell you that those programs exist not just in Chester County, Pennsylvania, but in every county and every state in the United States. They have different names, but basically they run through the county. So if there's anybody online who is not from Chester County, Pennsylvania, you'll want to check with your local Department of Aging and find a similar volunteer group. A little bit about me. I am on Medicare. I retired a number of years ago, and I decided to volunteer as a Medicare counselor. So I've been doing that since 2015. Have seen a lot of people. We have, I'd say, 27 or 28 volunteers in the group that I volunteer in, and we cover all of Chester County. So to your question, Bipin, about who's eligible for Medicare, I think everybody's probably familiar with the fact that when you become age 65, you become eligible for Medicare. So that's an age-driven thing. But many people may not be aware of the fact that there's another group of people who also are eligible for Medicare. Anybody who has been declared disabled by by Social Security standards. If you receive Social Security disability money or disability funding for 24 months, meaning that you're basically considered to be permanently disabled, you will be eligible for Medicare at that time. Now, there's a smaller group of people who unfortunately are much more ill. Those people who may have Lou Gehrig's disease or ALS, or people who are in end-stage renal disease, they don't have to wait 24 months. They are eligible for Medicare immediately. So again, it's people who are over 65, people who have been declared permanently disabled by Social Security, and again, people who have either end-stage renal disease or people who have ALS.
Great, great. So once we are turning 65, we get inundated with solicitations from all different healthcare providers that offer Medicare plans, various different Medicare plans. And the program that you have in Chester County, and as you said, this is also offered by every county in every state in the United States, they are the best places to provide unbiased information and education, because you are not selling anything. You are only providing information that a public can use to determine what plan is best for them and when to sign up. This is for seniors. And for others, the category that you mentioned, can they also reach out to you if they need any information in Chester County?
Oh, yes. Yes. We see many people who are on disability who have the 24-month clock tick. They are then notified by Medicare that they have become eligible for Medicare. They enroll, but then they need some of the other plans that you were talking about. So a little bit about how we work. We educate, as you said, but we don't sell anything. So we don't have what you might call, we don't have any skin in the game. We don't really market one plan over another. We don't really recommend one type of insurance over another. What we do is use the federal Medicare website. It's called medicare.gov. Open website, anybody can go to it, but we use it as well. And we use it to look at all of the plans that are available. When you see something on television or when you're inundated in your mailbox, it's a specific company marketing to their specific plan. We're just open board, okay? Everything that's available, we can show you and we can talk to you about.
Right. Now, one of the main mailers that you get are trying to sell you Medicare Advantage plans, which they say, okay, we offer something for everybody.
Mm-hmm.
Now, there is one, and then there are Medigap plans. So can you just give a brief comparison and contrast between these two, because that is one of the most confusing part of Medicare plan selection.
Mm-hmm. Well, it's hard to be brief about that. We spend a lot of time explaining that to people, but I'll try. So Medicare Advantage plans are plans that are all in one: hospital, medical, drug, some dental, some hearing, some vision. It's all rolled up into one card and one big plan. The issue with Medicare Advantage plans is that for the most part, they're network driven, meaning you have to stick to the doctors and hospitals that those plans have contracted with. And so some people like that, some people don't. It's difficult to travel or to move from one place to another with a Medicare Advantage plan. But that doesn't mean it's bad. It just means that you're restricted in a certain way. Some people like Medicare Advantage plans because their monthly premium can be as low as zero or very modest. The issue, however, then becomes every time you go to the doctor, you pay out of your pocket some copay. So that's how they're structured and that's how they work. You mentioned the word gap. There are plans which are called Medigap or Medicare Supplements. That means exactly the same thing. They work differently. They are not an all-in-one, roll it all up into one big ball. If you have a Medigap, you also need to buy an extra drug plan, for instance. So there are two different policies there. A Medigap is in general, on a monthly basis, premium-wise, more expensive than a Medicare Advantage. But the big difference there is that you have no restrictions. You can go any place in the 50 United States to any doctor, any hospital that takes Medicare, and you don't have to worry about being in a network or calling the insurance company or anything like that. So there are lots of other differences, but that's briefly the basic difference.
Right. And Medicare gap, the Medigap plan also allows you care if you are not only out of the network but also out of the country. It has a one time.
Let's have a little short discussion about that. Okay, both Medigap and Medicare Advantage will allow you limited emergency care, both.
Okay.
If you are out of the country, but that is limited emergency care, but limited, and it's an emergency. So you can't live out of the country and have any of that insurance. You can only visit or vacation or whatever. You know, you can't go for regular doctor visits, not on either of those types of plans, because basically Medicare, which is the backbone for both of those plans, only services and only exists in the 50 United States.
Right. And if members of the public want to reach out to you for information, they can contact you by a phone number that is coming up on the screen.
Well, let's talk a little bit about that, because there are a couple of different ways that we work.
Right.
So let me talk about the way we work before we talk about the phone numbers. So the way we work is that we do outreach in the sense that we're doing
Yes.
this right now.
Yes.
We also do outreach in the sense that we do Medicare 101, Medicare 102, sort of overall general, the rules of the road for Medicare in large groups of people. We do them at libraries, senior centers, a number of different places. We then do one-on-one counseling. When it gets down to what your specific need is, we can speak with you one-on-one. We can either do that at a senior center, or we can do it over the telephone or over Zoom. And then we have, I guess we'll call it a hotline. We call it a helpline. Monday through Friday from 9 to 5, we have a phone number, and you are scrolling that on the screen right now. That phone number will bring you to the hotline 5 days a week. And if you call with a sort of an easy, not too complex problem, we can probably talk you through it right there. If you have something that's more difficult, more specific, we need to see your paperwork. We need to understand more about what's happening with your situation. We need to do a one-on-one situation. So we've got a phone number for you to call where you can get easy to answer general questions. You can call any of the senior centers in Chester County and make an appointment to have one-on-one counseling. Or you can go to our website, which you're also scrolling there by pin, and there is a list of phone numbers and counseling centers that you can find there on that website.
Right. I think that is great information for people who need help and how to get it.
Mm-hmm.
Do we want to talk about different Medicare plans and how you, so that people who are not familiar with it can give a brief overview?
Well, we started talking about that a little bit before when you
Right.
asked a question
Yes.
about the difference between Medicare Advantage
Right.
and Medigap. So tell me more about what.
Okay. So plan A, B, and the hospital.
Okay, that gets into a complex. All right. So the first thing we need to understand is that Medicare, meaning the federal government Medicare, has basically two pieces to it. Part A, which is hospital coverage, and Part B, which is outpatient medical, your doctor, your x-rays, things like that. But that's roughly, and I say roughly because this is not a set calculation, but it's kind of roughly an 80-20 split. It pays 80 if you're enrolled in it, but you still have 20 that you'll have to pay out of your pocket unless you enroll in one of the plans that we just talked about, an Advantage plan or a Medigap plan. Now, Advantage plans today in Chester County, there are probably 30, 35 different plans that are available from a number of different insurance companies, and all of them have different features and benefits. They have to cover some minimum things that Medicare requires, but many of them have extra bells and whistles, which is one of the reasons they're called Advantage. And in order to really settle down on which of those insurance companies and which plans would be right for you, we really do need to take you through a detailed conversation about your finances, the drugs you take, the doctors you go to, so that we settle on a plan. If you're interested in going the other route, which is the Medigap that you mentioned, or the Medicare Supplement, there are, again, a huge number of insurance companies that offer those plans. There are not that many plans that are available in terms of what they cover. But the most important thing to know about the plans that are available through the Medigap or Supplement is that once you choose the type of coverage you want, I'll give myself for an example. I have something which is called a Plan G, which in today's world is the top of the line coverage. You can't get more coverage than that. But you can pay a lot less or a lot more for exactly the same coverage. So absolutely shopping is the way to go when you're looking at a Medigap or a Medic Supplement, because you could get coverage for $130 a month. So why pay $450 a month for exactly the same coverage? But again, it requires us to look through all of the plans and show you what's available to you. And then, of course, the decision is yours. So there are a lot of things to talk about and a lot of choices to sort of sift through. before you make a choice. What I would say is, especially on the Medicare Advantage side, do not listen to your next door neighbor who says, I have this plan and it's the best. Or my brother-in-law has this plan and he's had it for years and he loves it. It may be the best for them and it may be actually quite good, but your requirements, your drugs, your doctors may not be on that plan. So please, when you come for counseling, you'll recognize that we'll go through all of those details with you.
And there are some drug plans that cost as little as 50 cents a month.
Okay,
However,
so let's talk about drug plans. We haven't even talked about that yet.
yes.
All right, so if you have a Medicare Advantage plan, you don't need a drug plan because drugs are already built into that plan. It's an all-in-one.
Right.
If you have a Medigap or a supplement, yes, you need a drug plan. But our rule of thumb is do not focus on the premium. I don't see you, Bipin. Are you still there?
Yes, I am.
Okay. Do not focus on the premium. Bipin's focusing on the premium, but that's the wrong place to focus, okay? Because what you really have to focus on is what this is going to cost you over the year that you have it. And so what we do is take all of the drugs that you take, the prescription drugs only, no supplements or over-the-counter drugs, just prescription drugs, the dose that you take and the frequency that you take them, because all those three things are very important because some plans cover some things and not others. So we put all of that into the Medicare.gov software, and it will then list out the plans that are a good match for you. But what a good match means is that they cover the drugs that you take. No good if it's cheap, but doesn't cover your drugs. So the plan has to cover all of the drugs that you take at the dose you take, the frequency that you take, and most importantly, what those drugs are going to cost. Right. You mentioned one plan that had this year only, we've never seen it before, we may never see it again. One plan that has a monthly premium of 50 cents, which is correct. Last year, that same plan had a $7 premium. This year, it's got a 50-cent premium. However, where the money comes out of your pocket is when you start going to the drugstore right. and getting your prescriptions filled and doing the copays. So the software calculates the whole price. It takes into account the premium cost plus the drug cost and says, here's what you're going to pay for the whole year. And that's the way you make the decision. You never make the decision on
right. No, I'm just mentioning this because you also want to know that once you have chosen the plan, you are locked in until the next enrollment period begins, right?
And so that's a true statement in two places. It's a true statement for drug coverage. Each year, you can make a new choice if you wish. You need a review, and each year you can make a new choice. That is also true for Medicare Advantage plans. Each year you can make a choice, get a new one, get a better one, get a less expensive one. No problem. We help you. We look through the details and you find one that you like. That is not true in that easy way for Medigap or Medicare Supplemental.
Right.
Because once you make that choice, if you want to change, you certainly can shop and you absolutely can change, but you need to go through something which is called medical underwriting, which means they look at your medical history for maybe 5 years, 7 years back, and they make a decision about whether you represent a medical risk for them. Right. So it's true for drug plans that you can change once a year. It's true for Medicare Advantage plans that you can change once a year. You can change anytime you want for a supplement or a Medigap as long as you pass through medical underwriting successfully.
Right. And going back to the drug plan, as you said, you do a thorough screening for mm-hmm. what drugs they are taking, and mm-hmm. and you also may need to consider during the year if your drug needs change, then you are stuck with that plan. Is that right?
You are stuck with that plan, yes, but that doesn't necessarily mean that let's say you get a new drug that you haven't been ever prescribed before. Right. It's possible that plan covers it, so you'll be fine.
Right.
you might need a change in your prescription that says, I used to take 30 a month and the doctor's now telling me to take 90 a month. It's possible that your plan covers that, and it's possible that they still will only cover 60 a month. But whatever the change is, it's possible that it's still included in your plan. If you have a change that's not included in your plan, yes, you can use the word stuck if you want to. You're stuck with that until the next enrollment period. It's one of the reasons why you're allowed to change every year, because not only do those plans change every year, but your situation can change during
Absolutely, absolutely,
Mhm.
absolutely. Yeah, yeah. And as far as Medicare plans are concerned, as you rightly described, there can be a huge price difference between
Mhm.
from plan to plan. And
Yes.
and while all the plans uh, provide same kind of service, there may be a few plans that offer something additional at no extra charge, or that price may be just built in. Like I was talking about, some offer like a gym membership, like
Okay, so let's talk about that. If we're talking about supplements,
yeah,
there are very few, like maybe two not plans, insurance companies that actually offer a gym membership supplements. Otherwise, they don't have any extra
right,
things to offer. The
yeah,
place where there's a lot of extra things that get offered are on the Medicare Advantage side.
right, that's fine.
All of those plans pretty much offer gym memberships as part of it, but they very frequently offer many different things. Some of them, most of them will offer what they call an over-the-counter benefit, which means you have a certain amount of money that you can spend at the drugstore for things that are not prescription drugs. Sometimes they'll provide you with a catalog and they say, here, you can buy these things, and you get $150 a month or something like that. So when you talk about a lot of extra benefits, those are usually seen in Medicare Advantage
Right,
plans,
right,
and they're not related to the doctor that you go to or the drugs you take or the hospital. They're related to sort of everyday behavioral things.
right.
When
Yeah,
we talk about Medigaps, there are very few, and only recently, I might add, that have offered a gym membership.
right,
But
right,
basically, they don't have those extras.
right. Absolutely. And Medicare Advantage, as you said, they offer extras such as dental, vision, hearing aid. Again, those are very limited options, but
Well, I'll say one thing about Medicare Advantage plans over the years, at least over the years I've been doing this, which is
yeah,
almost 10 years, they have improved in terms of what they offer, those extras that you're talking about. They used to offer very little, and now they've actually, depending again on the plan,
yeah, yeah.
they actually offer more expanded, in some cases, dental or more money for hearing aids, things
Right,
like
right,
that.
right, right,
So again, when you make that choice, you really have to be aware of which of those services are the most important to you.
right,
You're a person that doesn't need hearing aids, at least this year. That advantage isn't going to help you at all.
right, right, right,
But if you're a person who has some, you know, needs an eyeglasses, for instance, that may help you this year. So
right,
that's why it's very important when you make the choice not to choose your next door neighbor's plan or the
right, right.
brother-in-law's
Yeah,
plan.
yeah,
Choose the one that has the benefits that are sort of fitted to what your needs are.
right,
You can make a change every year. Every year in this
right,
plan, you can make a change.
right, right, right. And as you said, Medicare Advantage plan also is network restrictive, so it locks you in. If you're traveling often or going away from your network area, then you will have uh, a very difficult time getting medical assistance, right?
Correct. Again, you'll get emergency assistance.
Right, right.
Always get emergency
Yeah,
assistance
yeah,
inside the country, outside the country.
yeah, yeah.
But some Medicare Advantage plans have very small networks, like your
Right.
zip code practically.
Yeah, yeah, yeah.
And some of them actually have larger networks. So again, if you're the person who is traveling to Florida in the winter, let's just say,
Right.
then, there are actually a few Medicare Advantage plans that do have some network that are actually in Florida, for instance. So
Right.
again, your personal situation is very important to match with whatever those plans are to get what you need.
Right. And then you also mentioned about emergency plans, emergency care within the country or outside.
Mm-hmm.
Uh, is there a limitation on lifetime maximum with different plans, or the
No,
same?
no, well, no, well, remember, Medicare Advantage plans you can change every year.
Right.
So you can go to a completely different company, a completely different plan. So there's no way to enforce any kind of lifetime maximum there because you're shifting from here to there. But no, not really. But I guess one of the things I would say is that if people have plans, not just vacation, but let's say they have plans to live outside of the country for half the year, or they actually decide to become an expat. They retire and they're going to live in Portugal or some whatever country. I'm
Right. Right.
picking Portugal out of a hat. Medicare is not going to be helpful to them. And none of the plans that we spoke about are going to be helpful to them. You need to make arrangements to get insurance in the country that you're going to be living in.
Right.
Now, we have actually seen people who do that because that's what they need to do, but they hang on to their Medicare coverage in the event that they decide they want to move back to the US or they want to travel back to the US. But of course, that means, they've got sort of double bookkeeping going on there. But as long as you pay your premiums, you can hang on to that coverage.
Right. Maureen, this has been a very useful session that you provided our viewers with. We reviewed all the different plans, the differences between the plans, and how they can reach out if they are in Chester County to the numbers that are on the screen.
Mm-hmm.
And as you also mentioned, that if they are outside Chester County, then best to reach out to their local county in whatever state they are in.
Correct.
Because every county is providing this great outreach program to its residents,
Mm-hmm.
because Medicare can be very confusing, and you do an amazing job in providing that guidance one-on-one.
We appreciate the compliment, and we always appreciate being able to be here to talk to more people about it. But I would say that when you reach out to whatever county you're in and whatever state you're in, usually it's run through the Department of Aging or some department in the county, that has that title or sounds like that.
Right. Yeah. Do you want to briefly, or just take a few minutes to summarize the services once again, and as we close this very useful program today?
Do you want me to summarize how to get in touch with us?
Yeah. And then also just summarize what services you provide for a few minutes.
All right. So we provide information to anybody who's eligible for Medicare. That means those who are 65 and older, or those who have been declared disabled by Social Security for 24 months, or those who have end-stage renal disease or ALS. We provide information and advice to all of those people. What we provide is information about how to enroll, all of the plans that we talked about, but we also provide information to people while they're on those plans and while they're on Medicare. If they have issues, questions, problems, they get a bill that they don't understand, they think they're being charged for something, Medicare has refused to pay for it, many different questions. We also give advice to people who are low income about which programs are available to them to help fund some of their Medicare coverages, or if their income is low enough, how to apply for Medicaid, which is a state-run program, not the same as Medicare. there are many different questions that people come to us, not just when they're enrolling and not just once a year when the changes happen, but we see literally hundreds of people every year. As I said, we run the helpline Monday through Friday, 9 to 5. I was on 2 days this week, and random questions from all kinds of people who've been on Medicare for years and people who are just entering, the Medicare phase. So we do all of that. And we do it, as I said before, by these kinds of one-on-one presentations that we're talking to you. We do presentations to large groups. We do one-on-one in-person counseling, one-on-one on the phone, one-on-one over Zoom, all of which is designed to sort of help people either make a choice or solve their problem.
Absolutely. I think that is phenomenal that you offer this service. And
we're always looking for volunteers. So
right,
if anybody
right.
would like to volunteer to become a Medicare counselor, definitely in a great need. Again, no matter where you live.
Right. Great. Maureen, I thank you very much. We bring this podcast every Saturday at 10 o'clock. And on this episode, we had Maureen Morgan from the Medicare counselor from Chester County's Department of Aging. So please tune in next Saturday at 10 o'clock when we will be talking to another interesting guest providing information that we can use. Thank you very much and have a nice day, Maureen.
Thank you.